Hello and welcome to ITENEV Healthcare Solutions webinar, Deep Dive into the NextGen PXP. Thank you all for joining us today, and wow, let me just start off by saying that this is clearly a topic that is very important to many of you if attendance is anything to judge by, so thanks for joining us today. My name is Chelsea Grover and I'm the Marketing Communications Manager for ITENEV. Before we get started on today's webinar, I wanted to take a moment to explain the process for the presentation. First, I'd like to mention this webinar will be recorded and that we'll send out a copy of the slides along with the recording within the next week. So also keep that in mind in case you have to jump off early or anything like that. Anybody who registered for the webinar will receive a copy of the slides and a link to the recording. So don't worry because this is jam-packed full of information. Okay, so next, for those of you who aren't familiar with ITENEV, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. We also have NextGen add-on productivity solutions, including ChartGuard, Refund Manager, Unapplied and Deposit Manager, and Multiple Encounter Billing Manager. If you'd like to learn anything more about what we do and the services we offer, please feel free to reach out to us in the chat box and we'd be happy to hook you up with some more information. Okay, so next, I wanted to draw your attention to a new opportunity that we're offering right now. We want to know what you want to know about next. So as I said, this one's clearly a very popular webinar, which we can tell from the attendance numbers, but we want to know what you want to hear about next. So if you jump over at some point to our LinkedIn page, linkedin.com/ ITENEV Healthcare, just search for us in LinkedIn. Fill out this survey so we can know, kind of weigh in on what you want to hear about next. We were only limited to 4 different options, which meant that we couldn't go into different NextGen specific topics that you might be curious in knowing about. So if you want to know about those, please weigh in, vote. Currently, social determinants of health is ahead of the pack considerably, but there's still 6 days left. So please join us there and vote so that we can, honestly, we do these webinars for you. So we want to know what you want to know about next. So please chime in on that. Okay, so back to today's webinar on the NextGen PXP. At the end of the presentation, we'll open the floor up to questions from you. We'll answer them all at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you, and we'll just go through them in the order that we received them. So feel free to type them out whenever they occur to you. If it's something specific to a slide that we're covering, because I'm guessing that we'll have a number of questions on this one, please kind of give some context so that when we get to the end, we know what area of the presentation your question was referring to. Okay, and finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Holland Liley is a consultant with ITENEV, and Lexi DeMarsh is a manager of consultant development at ITENEV. They're both some of our deepest subject matter experts on the new PXP, so we're really lucky they were able to join us for today. And without any further delay, Lexi, I'll hand it off to you.
Okay, thank you so much, Chelsea. And thank you to all of you for being here today as we kind of take a deeper look at the patient experience platform, specifically the PXP Portal. So with this new PXP Portal, your practice is really going to see, they took some of the best pieces of that legacy NextMD portal and combine them with some new functionality into one really user-friendly solution. So as Chelsea said, we do have a ton of information to cover today, so there's a good chance that I'll go right till the end, but we'll stay around for as long as you guys need for questions. But as she said, if you do need to hop off, because I know, like I said, we'll get close to our time limit here, the slides will be sent out. So I just want to reiterate that. Okay, so before we jump into our actual overview of the PXP portal specifically, I did just want to take a moment to review the patient experience platform as a whole. So if you're not familiar, the patient experience platform is actually made up of several different applications. They all kind of work together, and really, the focus is to give patients, the ability to access their healthcare data, but also be able to interact with you. So with the providers and the staff, kind of do it in a seamless way, make it as easy as possible. So the first piece of the platform is the patient portal. So obviously that's going to be our main focus today. In addition, there's several add-on features that we'll review as well. Those are the patient self-scheduling feature, as well as NextGen PreCheck and NextGen Pay. So those all can kind of integrate, and we'll see how they connect to the portal. And then finally, there are two additional applications that we won't be reviewing in depth today, but those are NextGen virtual visits, as well as the NextGen measure feature. And with all of these together, they complete what is referred to as the Patient Experience Platform. So now back to our main focus for today's presentation. So this is a sample homepage for the Patient Experience Platform, so from the patient's perspective. So we have a lot of different available features. So we have our secure messaging feature. So that's our messages and ask a question icons. We have the ability for patients to submit appointment requests. So those would go to the practice and then you would respond to those requests. We also have our patient self-scheduling features that be accessed with this schedule appointment icon here on the homepage. We also have the ability for prescription refill requests to be sent to the practice. We have our bill pay feature. So as you can see, this allows a patient to see any kind of balances they have, as well as make payments to those balances for outstanding balances, as well as co-pays. The portal does have a health forms feature. So this allows patients to complete some health forms, give you some demographic or clinical data before they're actually, in the practice. We have our health record. So that is going to be basically like a patient-friendly CCDA that the patient can review, to see their information that was documented. And then finally, there is actually one additional icon that we just, for sake of space, I couldn't fit on here, but that is patient education. So that is the ability for patients to access. It is different than HealthWise, but it's a separate feature that allows them to search for documents. They can search kind of like HealthWise, by condition, specific medication, a procedure, and get some information directly from the portal instead of having to reach out to the practice. So this portal webpage is accessible from a computer as well as mobile devices. So it's kind of convenient for whoever the patient wants to access it. I did want to point out that from our experience, some patients have reported when they are using a web browser other than Google Chrome or Firefox, they might have some issues with viewing the different features. So, being able to submit a prescription refill request, schedule an appointment, things like that. So kind of a quick troubleshooting tip, if you are hearing that from patients, I would just ask what browser type are they using? If they're using Microsoft Edge or Internet Explorer, if they have another option, if they have Chrome or Firefox available, that might help with being able to have the full functionality we see here. Okay, so now that we've kind of had our high-level overview, I wanted to begin kind of our deep dive into the PXP portal by reviewing your practice's options for configuring the portal to be exactly what you need. So there are several locations that a practice can go to complete the configuration of the PXP portal. So after that initial configuration that the practice will go through, these configuration tools can be used down the line to make minor tweaks as needed. Maybe a new provider's joined your practice, or you want to reconfigure the questions available, whatever it may be. You can do that with these tools. So the first tool is one that is typically only accessed by users kind of more in an administrative role. So that is our site generator. So that's kind of our main configuration tool. It allows you to enable the features that your practice is going to be using, as well as configure certain settings. The second tool that you have is the PXP integration tool. Just as a note, this is referred to a lot, especially by NextGen directly, as the PPIT. So like P-PIT. Always kind of makes me laugh, but just so you're aware, that's the same thing if they ever, support ever uses that term, or implementation team. So this tool basically contains several settings that allow really the integration of the PXP portal to your NextGen environment. So we'll see kind of in a later slide, how some of that information can be used, as well as to be able to review data that's submitted by the patient. We'll also see that there are a few system master files that are found in file maintenance for configuration. So this is kind of pared down to the settings that we saw with the legacy portal, but we'll see in a few slides that there are still some master files that can be used. In addition to those tools on that previous slide, you also will have access to what's called the practice portal. So this is a web tool that this is typically used a little more widely at the practice, so not just necessarily administrators, maybe the front desk would have access to this. But this basically allows you to view as well as manage portal enrollment, as well as if you are using the bill pay feature, this is going to allow you to have a little more visibility of that online payment data. And then another web tool that again would be used by kind of more users within the practice is the appointment dashboard. So this dashboard basically allows users to view upcoming appointments, as well as data related to the PreCheck functionality. So if you have are using that, as well as patient self-scheduling. In addition, we also can see reminder information there. So when reminders went out, if there were any issues, if it went out but the phone number was invalid, things like that. And then finally, if your practice does choose to implement the patient self-scheduling, there is a separate web tool, and basically that admin tool allows you to configure the settings specific to that feature. So I know what you're probably thinking, that is a lot of different locations to go for configuration, but don't be overwhelmed. Your organization will really be guided through this initial setup, and so, really the foundation should be there. And then a lot of the tools, only really need to be accessed when changes need to be made. Like, I mentioned, for example, if a new provider joins, you might need to go into that site generator and set up some configuration for that provider. But in reality, the tools that you see listed here are probably going to be accessed more frequently than on the previous slide. So once you have gone through and configured that PXP portal really to suit the needs of your practice, you can begin enrolling patients so they can take advantage of all the great features. So enrollment in the PXP portal, it can either be automatic or manual, so just kind of depending on the situation. So regardless of the method that's used to initiate that enrollment, a patient's chart is required to have some basic demographic details. So those will include what we see here on the slide, so last name, first name, birth date, birth sex, zip code, as well as an email address. I did want to point out one thing that I've noticed working with some practices is a field that might cause some issues is that email address. So if you were on the legacy NextMD portal, you're probably aware you have the option to print out that token, and physically hand it to the patient, as opposed to sending the invitation through an email address. So if that's the case, you might not have an email address for all of your patient population, or they might not be up to date. So just as a note, as it stands now, the PXP portal will only send enrollment invites through email. So that's something good that you can start today, even if you're kind of a long ways off from maybe implementing this portal. Going through and just making sure you have those email addresses and they're up to date. So then once all those fields are entered into the patient's chart, that enrollment invitation is sent. So you can see some of the automated options. So either when demographic changes are made, so either they are added, for example, like if the email address is missing, or they're updated, it will send an invitation. Invites will also send when an appointment is created. As well as there is a final option that can be utilized during your implementation, and that's our bulk invitation. So basically that will allow you to send invites to all patients that were previously using the NextMD portal if your practice was using that previously. So that can be a really easy way to kind of kickstart that enrollment and get you started on the new portal. So in addition to those automatic options that we just reviewed, as I mentioned, patients can also be manually enrolled. So this can be done at any time. So any user that has the access can click that Enroll Now link, and that is found in both the EHR and the PM application. It really simplifies, it's just a single click, and that will send out that invitation. So that can be done at any time. So A registration email is then sent to the patient once they are initiate that enrollment, and they will sign up for the portal by creating a username and a password. So there are several requirements for this portal password. So they include some of those usual things I think we all have come to expect nowadays creating a password. So you need a capital letter, a number, symbol, things like that. But one of the less obvious requirements is that the password cannot contain any what NextGen's calling common words. So some examples of that would be any part of the patient's name, so like their first name, last name, or even the word password, which sometimes, if patients are really trying to simplify it for themselves, they might include that. So I did just want to point that out specifically because that is something that I've seen, several times with patients. They'll get an error message and it may not be completely clear what the issue is, but luckily it's a quick fix. They just need to, make sure they follow those requirements and don't have any common words included. Okay, so now that we've reviewed kind of briefly how to configure that portal to enroll your patients, let's dive into the different features and kind of look and see how those would work. So the first feature that we're going to review is secure messaging. So secure messaging feature really mimics what you had previously if you were using the legacy portal. So this allows patients to compose as well as receive messages. So from either different users or user groups. So maybe in this example, like we have Ask Billing and Ask a Provider. Message routing groups can be used, and that can help to guide patients in the selection of who that message should really be sent to. So one of the first steps to setting up the options for secure messaging is configuring what we call message labels. So basically those message labels are created to kind of guide patients so they can select really what information they're looking for so it can be sent to the right individual user or group. So these labels are created in Site Generator. So we have a category called Ask a Staff. So basically you would come in here and you would create new question labels for basically each different option that you want a patient to see. That kind of got out of whack for us, our box there. But so once all those question labels are configured by the practice, there is a potential additional step of configuration that you may need to complete. So this would be if you do want to give patients the option with a question to go ahead and select a location and or a provider to specify that they are trying to reach out to. So if they are a patient at a certain location and they want to specify that, they can do that. So in order for that all to work correctly though, we do need to set up permissions with our question labels. So basically they allow the patient, like I said, to select either a location or provider. This is also done under that Ask a Staff section that we were just looking at. You would select Set up Permissions and then choose that Manage Solution for Users tabs. And then you would go through and enable that for each individual user that should be assigned. So once we've created all those message labels, made sure the permissions are set up correctly, the next step would be to configure those message routing rules. So basically these message routing rules, they function kind of like what we saw with the legacy portal. Basically you can set up to route those messages to either a user or a work group. So these message routing rules are going to be created in our PXP integration tool. And you can create a default rule that will kind of be a catch-all. So if any message labels aren't assigned to a specific location or a user, you can select one user that would be able to receive those messages. So that can just kind of help to make sure that no messages are going unaddressed. And then additional routing groups for each message label can be created. So you can make these specific to a location as well as a provider. For example, if each provider in your group has a specific nurse or MA that typically works with them, you can create different groups for each provider under that same question label. In addition, with the setup, you can assign an alias, and that basically will allow when a user is responding to that message, it will show the alias instead of the individual user's name. So, for example, it might be nursing staff or billing staff or whatever you'd like it to say. So that way, it kind of just routes them to that group instead of an individual user. And once those routing groups are created, they can be assigned to users, user groups, which are kind of the equivalent of work groups, or even security groups from system admin if you'd prefer to assign them that way. In addition to those message routing rules, online profiles can also be created. So online profiles in the PXP portal is going to have the same functionality that we saw in the legacy portal. So this is where we would actually create those aliases that I just mentioned on the previous slide, which again is what would be visible to patients in that from line when they receive a message or a reply to a message from the portal. So kind of similar configuration, you would basically set up what the alias should be, and then you would go through and select either individual users or task work groups that would fall underneath that alias. Okay, and then practices will have the ability, to view messages in the inbox in the EHR as well as the mailbox in PM. So really all the same functionality we're used to seeing, the ability to compose a new message, reply to a message, reassign a message if it should go to a different user or work group, forward a message, add it to the patient's chart, as well as even send tasks from within this inbox. So the next PXP portal functionality we're going to look at is the ability to schedule appointments. So we actually have a couple of options that a practice can choose from as far as scheduling appointments and what options they give to patients. So the first option is appointment requests. So this feature basically is going to allow a patient to complete a form requesting an appointment, and then that's sent to the practice to review and then go ahead and actually schedule that in your appointment book. So the patient will start by selecting their desired location and provider. They will see a list of previously seen providers if they're not new to the practice, as well as the option to search for a different provider if they prefer. So once that location and provider have been selected, the patient can either request just the first available time, if they're not, don't really have a preference, or they can go through and select, you can see different times of the day, different days of the week, whether they prefer this week or next week. So you can go in and either, select those preferences. And then finally, the patient would complete that reason for visit section that basically just gives you some information to allow you to determine what the correct appointment time should be once the practice actually schedules that appointment in practice management. So once that appointment request has been submitted by a patient, the details can be reviewed in the patient portal tab of either the EHR inbox or the PM mailbox. So the appointment can be scheduled directly from this request message by selecting that schedule an appointment button. That will give you the appointment search ahead window, and you can enter that search criteria. It will fill in things like the patient's name, things like that, but you can fill in the rest of the criteria and find the next available appointments. I did just want to point out that this appointment search ahead isn't going to pull in an event type. So that is what we'd use that reason for visit to go ahead and select the correct event type. And then that will be required, as you're used to with the appointment search ahead before you can search and find that appointment that's needed. So the other option that we have for appointments from the PXP portal is to allow patient self-scheduling. So, as opposed to the appointment request, this actually allows a patient to go through, select the appointment date and time that they would like. They would go through a series of questions to find the event type that's appropriate, and then that actually schedules it directly on the appointment book without any oversight needed by the practice. I did want to point out that this is one of the add-on features to the base portal. So our appointments made using self-scheduling, they will be labeled with PSS, which is the shorthand for patient self-scheduling. We will see that in the appointment details of the appointment itself, so you can quickly identify that this was self-scheduled, as well as there are several reporting options. So if you're thinking, you want to be able to track these and kind of, review them, there are some options for that. The practice will also have a lot of control over which appointment types, providers and locations are even available to be self-scheduled. So if you are, multi-specialty, maybe certain specialties within your group you would like to not have self-scheduled, so you have the ability to really control that. And there is also an option to allow self-scheduling through a link. And basically that allows patients to schedule an appointment without having to first log into their portal account. So that link can really be placed anywhere, like a lot of times it's on the practice's website, if you would like to give patients that option. So the configuration for this feature takes place into what is referred to as the patient self-scheduling admin tool. So we can find a shortcut for this tool in our site generator. So there really are numerous settings for the self-scheduling. Can really allow your practice to customize that experience. Like I said, for example, certain locations. You can even, enable instructions to be visible in Spanish if the patient, if you have multilingual population. You can even create announcements that will display throughout that self-scheduling workflow, giving patients additional instructions. So practice can also use this tool to define the order of the screens that the patient will see when selecting an appointment. So this really isn't one size fits all, it can really be customized. You can have multiple variations, if you want to give the patient a choice of where to start. For example, maybe one patient, wants to start by selecting a particular provider, but they're not as picky as the location of the appointment. As where another patient may not care which provider they see, they just want to go to the location, maybe that's closest to their house. So we have the ability to kind of choose the order of, what options they see when they're selecting what available appointments there are. Another feature that really can be highly customized for a patient self-scheduling is the use of what we call decision trees. So basically, decision trees are a series of questions that can be configured, and it basically prompts, based on the patient's answers, the system will select the correct event type as the patient goes along. So these decision trees can really be used, in place of having the patient try to decide, what appointment type is appropriate when they might not know, how your practice is set up. So in our patient self-scheduling admin tool, our decision trees are set up as categories. So these categories can be created in both English and Spanish. So again, another option just depending on your patient population. And they can also be configured to be specialty specific. So again, if you want to ask different questions based on the different specialty, or even prompt, based on the specialty the patient selects, they need to call the office to schedule. That's an option as well. So each branch of a decision tree can have one of three options. So the first is a message. That message basically provides a hard stop for scheduling. So kind of like the example I just gave, this is typically used for different appointment types that you want the patient to call the office, or maybe, there's more information that needs to be gathered before they can schedule an appointment. Another option is a question. So that continues to prompt the patient with another question. Basically, it gets them, one step closer to being able to selecting the correct appointment type. And then our final option, which is the end goal of the decision tree, and that is the appointment type. So that will choose based on the answers provided. It will select the event type that will be added to the appointment that is ultimately going to be created. So here is an example of the start of a decision tree. So you can see that first box would be the prompt that a patient would see when they go to schedule their visit. So ours is kind of just generic schedule your visit, but based on that first prompt, you can have, for example, here like a question. So it asks the patient, are you feeling sick? Based on that response, we can see here, the patient has 3 answers they can choose from. So yes, no, or other. So for example, if the patient selects other, they are prompted with the next question is if they're not feeling sick, why do you need to be seen at our practice? So based on getting to that question, they'll be presented with 3 additional answers. So here in this example, we have the option to say for a procedure, a flu shot, or COVID testing. Based on the options that they select here, they are either going to see what we see in those red boxes under procedure and flu shot, and those are our event types. So if they select either of those, then it's going to select the event type for them. And then what we see down there in that yellow box is what's going to default for the reason for visit that we'll see in our appointment details. But let's say they select that third option, which is COVID testing. So this is, in this example, the practice wants a hard stop here. So they'd like the patient to call the practice, and maybe they have some additional questions, some different scheduling that is a little more advanced than just for self-scheduling. So in this example, in that green box, the patient is presented with a message that asks them to call the office to schedule for that particular visit type. So then they can choose to end the scheduling process or go back and select different options if needed. So based on all of that configuration that we just reviewed, then patients are guided through that predetermined workflow that will ultimately allow them to choose the appropriate appointment type for them. So the available appointments that are displayed for a patient are going to be determined based on the choices the patient selects. So as we reviewed before, the options are location, resource, as well as specialty. So then once configured, the patient will complete that decision tree and basically will guide the system to select the appropriate event type. So there is an additional option of this workflow, and that is to include insurance information. That will ask the patient to, in addition to scheduling their appointment, to review what, if any, insurance information is on file, as well as they can make updates or add new insurance if it applies. So I did want to point out that this insurance details that the patient may provide during this feature won't actually update what is in NextGen for the patient. So it's not going to go into that insurance maintenance window and make changes. Instead, those details will come over on the appointment. So either in that appointment description box or like we see here in our appointment details. So this can then be reviewed and compared to what's already in the patient chart, and any updates can be made as needed. Okay, so now I'm going to turn the webinar over to Holland, and she's going to walk you through how patients can use this portal to manage their prescriptions.
Hang on, before you hand it over to Holland, I did want to chime in and say we've received a number of questions, especially right off the bat. If we've gotten to the questions and answered what your questions were as we go throughout the webinar, please feel free to chime into the questions box again and say, never mind, you answered my question or anything like that. Because I know that we did get a number of them right off the get-go, and we will have sections on them. But on the flip side, if we didn't answer that question fully, then feel free to leave them. Thanks. Holland, all you.
Thanks, Chelsea. And thank you, Lexi. So now we're going to be looking at some prescription refill requests. So in the PXP portal, patients are going to have the ability to request a refill of an existing prescription, or they also can request a new medication. So a patient can request a prescription on the portal based on a list of both the active and inactive medications from NextGen. In addition, medications can be manually searched using that drop down that you can see above in that image in the request a new medication field. The pharmacy associated with the request can either be selected from a list or they can manually be added by the patient. The list of pharmacies does not pull from file maintenance at this time, and instead the list is going to be maintained in Site Generator. The patient won't see their default pharmacies from NextGen, but they will see any previously selected pharmacies from past requests. Requests for prescription refills or new medication requests are going to be sent to the patient portal tab of the inbox based on the message routing rules configured in the PXP integration tool. And the practice can respond back to the patient with either an approval or a denial. If approved, that medication will need to be documented and sent from that medication module. Alongside our prescription referral requests, we can look at our health forms. So another great time-saving feature of the PXP portal is the ability to create and distribute health forms. So the health forms can be utilized to collect clinical and financial details from the patient, as well as digitized forms such as consents and privacy notices. There are three main types of forms that can be configured for your practice. And the first is going to be a general registration and health history form. The form comes pre-built with the installation of the portal, and the data from the general registration and health history form flows right into NextGen as discrete data. So what that means is the data is going to be added directly to the patient's chart or demographics. Another option is your custom patient forms. These forms can include questions, checkboxes, radio buttons, and even prompts for an electronic signature. The data from this form type will come into NextGen as a PDF, and that's going to be reviewed, and then the data can be manually entered as needed. The final option is the use of instant medical history or IMH forms. If you're not familiar, IMH forms use decision-based questionnaires to collect data. So these forms are going to be sent to the patients as an attachment to a portal message, and then once completed, the information is going to come into NextGen as discrete data. I do want to note that this is an add-on feature, and it will require a separate purchase of the IMH product. So for the forms that come into NextGen as discrete data, the information can be reviewed by practice staff before updating the chart or demographics. So this can be done utilizing that PXP integration tool. This tool is going to also show forms that have been returned. So there are two columns in the view, the current EHR data and the portal data that will be able to be compared with the changes that are made. So with this option, users will also be able to import or bypass data as needed. Before looking at a sample of the tool, I do want to point out that for those of you who have adopted the PXP portal in its mid-fusion days, the portal system or practice template that you guys are used to seeing in the EHR has been retired. So in its place, all the practices can utilize the PXP integration tool. So in this example here, we are reviewing a completed health form. So that first column shows up as what is currently documented in the EHR, and the second column displays what was entered by the patient in the portal form. And again, each change can either be accepted or bypassed. Any configuration of custom forms is going to take place in Site Generator under the Forms section. The general registration and health history does come pre-built during installation, as I mentioned before, but it can be customized as needed. So a practice can decide which sections will display, as well as apply filters for things such as age range, location, and provider, and they can create several versions of the forms as needed. Under the forms section is also where a practice would create completely custom forms. So the forms can also have filters for things like age range, location, and provider as well. The patient can be prompted for information needed through question box, answers lists, and consents that have e-signature functionality. So in this example here of a customized patient form, you can see that a section for medications and allergies was created, and then questions can be entered and a list of acceptable answers will be defined there for those selections. Here's another example of a consent section that can be added to a custom form. The consent agreement title and statement can both be customized, as well as that e-signature option can be enabled too. The custom patient forms that come into NextGen as a PDF are going to be found under the Categories tab of the Patient History toolbar. And you will also be able to see a PDF copy of the General Registration and Health History form under that same tab. So now I'm going to turn the webinar back over to Lexi to continue to review some additional great features of the portal.
All right, thank you so much, Holland. So continuing on, the next feature of the PXP portal that we're going to explore is the health record. So this health record is a tool that can really take that administrative burden supplying those records off the practice. So under the health records section of the PXP portal, patients can view as well as download their personal health record, or PHR. So this record is sent from NextGen, and I kind of describe this as a patient-friendly CCDA, so it's kind of in more user-friendly format. So there are several instances when that personal health record would be generated from NextGen. The first is after the patient completes enrollment in the portal. So right off the bat, a complete record of the patient's clinical data is automatically uploaded to their portal account. The next scenario is when a clinical encounter is locked in the EHR. So this will trigger an update of that PHR that will automatically send to the patient, and they'll get a notification, that visit information's been updated. That personal health record can also be manually generated by the practice, at any given time, using that medical summary utility. And then the final option is for the patient to request for an updated health record. And they can actually do that directly into their portal account, and it automatically sends. So it doesn't require any interference or any follow-up from the practice. So this health record in the portal consists of things like any documented demographics, as well as clinical data, so things like medications, allergies, as well as some visit-specific information. That visit data that's updated on the personal health record, it's going to happen automatically, as I mentioned, when that encounter for the visit is locked. Included in that health record is also lab and radiology results. So these results will be sent to the portal along with the visit summary CCDA, as long as two criteria are met. The first is that the lab results have been signed off on in the provider approval queue. And the second is that they are received before the encounter locks. So if that doesn't happen, there is also an option to manually send those results. So that can happen either from the orders module as well as from the PAQ. So there are some options in the PAQ I did want to point out for providers to send those results. So things like action sets or even custom rules can be set up. So here is an example of a portion of the health record within the portal account. So you can see at the top, the patient can see the date and time that that summary was sent, so they can know, how up to date that information is. There will also be a list of past summaries if the patient did want to look back historically at those, information sent. They can scroll through this data and, review any updates. If a patient would like to download a copy of this health record, that can be done directly in the portal as well. So the record is downloaded as a PDF, and that can be shared either using a direct address of another healthcare provider, another organization, granted if the patient knows that information, or also a standard email. And patients even have the ability to request an updated personal health record. And like I said, they do not have to contact the practice to do that. So when that request is made from within the portal, an updated CCDA will automatically be sent to the patient once it's ready. Something important that I did want to note is that once this request is made, the data that's documented in the patient's chart will entirely be sent. So this could potentially include data from both locked and unlocked encounters, if any of those exist in the patient's chart at the time the request was being made. So I'm sure some of you are thinking, the concept of patients having access to their health data, at their fingertips, it's exciting, less administrative burden. But I'm sure your minds are running, of all the ways that having that data, readily accessible can potentially go wrong. So one of the solutions to that potential problem is the use of sensitive encounters. So if you're probably already familiar, the ability to mark an encounter as sensitive in the EHR application. And if that is the case, then an updated PHR will not be sent automatically. That doesn't mean you can't manually include this information, it just doesn't go with the automatic update. So this is one way their practices can have a little more oversight. And then, like I said, if it's appropriate, can manually send that data. So to use this feature, when an encounter is marked as sensitive, the suppress auto send to patient portal option should also be checked. So another great time-saving feature for a practice is the ability to allow patients to view statements as well as make payments directly from within their portal without having to involve any billing staff. So this feature is referred to as NextGen Pay, and I did want to point out this is another one of those add-on features to our base portal. So if this is selected by the practice to be used, when a patient is logged into their portal account, they'll see that icon that will allow them to see if they do have a balance. This is at the guarantor level. They can also view any past statements as well as then make payments. So payments through the portal can come from a few different sources. So the first is the option we were just talking about, that pay bill icon, and that is what is displayed on the patient's portal account when they log in. The second option is a feature called Pay Here, and that is that second screenshot that we can see on our slide, and that basically allows a patient to pay a bill without having to log into a portal account. So they would go to the portal website, but instead of logging in, they would click that Pay a Bill button. Another option is for practices to enter portal payments on behalf of the patient, and that would be done in the practice portal. And then finally, payments of balances as well as copays can come from the PreCheck process. So we're going to cover that a little more in depth in our next section. But regardless of the source of the payment, a transaction is going to be added automatically to a batch within the PM application. Practices will then have the ability to review these transactions just like you would with any other batch, make modifications before it's posted. So like I said, that workflows, it's very similar to what we saw previously with the legacy portal. So a practice does choose to enable this feature that's done in Site Generator. And then patients will have the ability to make payments without having to log into the portal account if they enable that login list feature. The link to make that payment is visible, like I said, on the patient's portal page, but instead of logging in, they would just go ahead and be able to pay their bill. So a patient will enter all of the required information, so things like the patient's name, date of birth, the credit card information for the payment. And then a practice can also decide if they want to set the account number field as required. So basically, if you do set this as required, it's just going to prevent payments from being made unless they do have a valid account number to add. And then once all of that required information is completed, the patient can submit the payment to the practice. If a patient does log into their portal account before making a payment, they will also be able to see things like any outstanding balances. They will also have the option to save one or more credit cards to the portal to be able to be used for future payments. And the account number field on this window is read-only if the patient logs into the portal. So it's just to help the patient identify the account that the payment is going to, if they do have that information on hand. So once a payment is submitted from the screen, a receipt will be emailed to the patient, and it will be sent to the email that's associated with their portal account. The patients will also have the opportunity to print a copy of this receipt on the payment confirmation screen if they prefer to do that. Additionally, they can make payments on the screen. Patients will also have the ability to see past payments that have been made on that payment history tab. In addition to making those payments, viewing past information, statements are also supported in the PXP portal. So when a statement is available for viewing in the portal, the patient's going to receive a secure message notification. They would log then into their portal account and view that statement. Patients can then view as well as download that statement as PDF documents. Patients will also have the ability to choose the format in which they'd like to receive statements. So depending on your practice's setup, the option could be electronically, by paper, or both. You do, as a practice, have the ability in Site Generator to disable paper statements altogether, So it would only give the patient the option of receiving electronic statements. So here is an example of what that patient would see when they log into their portal account and click on that statement tab. So as I mentioned, they can view the statement from here, print it, or even download it to their computer. Okay, and then the final PXP Portal feature that we're going to review today is another add-on product, and that is our NextGen PreCheck. So PreCheck is a feature that can really, save time for both patients and your staff, when checking in those patients once they arrive at the office. So the PreCheck feature gives patients the opportunity to complete the check-in process, some of those steps before they even arrive in the office. So one of the options that you can offer to patients is the ability to confirm or even cancel their appointment. Patients can also enter preferred pharmacy details, so you can collect that information before they're in the office. And a step can also be added to ask patients to review or even provide their insurance information. This can be set up to include the ability to upload the insurance images, so that way you have that information, again, one less step during check-in. We also can see registration and other custom forms can be provided to the patient. So you gather some of that clinical and demographic details. And then finally, co-pays and any outstanding balances can be paid during this PreCheck process. So the PreCheck process is configured on our appointment dashboard under our settings option. So we have a couple different settings here, but on our PreCheck tab, we can come through and select different steps in the check-in process that can be enabled. So things like, do we want to enable demographics, that insurance collection with the images, co-pays, balances, things like that. So the process to review changes or updates to any patient data during the PreCheck process is the same as what we saw for our health forms. So we do have the ability to use that PXP integration tool, and that information will come through as discrete data that can then be reviewed. And again, you can go through and either choose to accept or bypass the individual data that come from the PreCheck process. So as you can see, there are many great features with the Patient Experience Platform portal. So hopefully you and your patient population can really find a way to leverage this to make accessing that health data and contacting your practice a little easier. So now let's get signed out so I can turn it back over to Chelsea to explain how we can help your practice. And then finally, we will open it up for questions, which I hear there are a lot of them. So we'll get right to that.
Okay, thank you, Lexi. And again, thank you everybody for joining us today. I'm just going to breeze through these last few slides here so we can get to your questions. So I did just want to say next steps, as I mentioned earlier, please follow us on LinkedIn, chime in on that poll that we're asking what you want to hear about next for our upcoming educational webinars. Please feel free to reach out to us regarding some of our additional services that you might not be aware of or that maybe your practice is looking for. For example, we have 3-day fixed price on-site consultations that will come out to your practice and review your workflows or really any other area of your practice for a fixed set price. So there's no surprise charges or anything like that in there. Also, we have a couple of NextGen add-on products, including ChartGuard, Refund Manager, Unapplied, and Billing Manager. And a number of other things that we can offer to help your practice basically use NextGen smoother. That's the whole reason that we exist. We're NextGen focused. We've been doing this for a really long time now, and we are happy to help. So please feel free to reach out to us for information on those. Okay, so getting to the questions. As I said in the beginning, we're just going to go through these in the order that we received them. If you have to jump off before your question's answered, they will be included in the recording that I'll send out in a few days here, along with a copy of the slides. So don't worry if you have an appointment to get to directly at the top of the hour in case we don't get through the questions in the next 6 minutes. Okay, first question. Oh, and as I said previously too, if we did answer your question that you might have asked earlier in the presentation, feel free to chime in and say, never mind, you answered my question on X, Y, and Z. That way, in case you've asked a couple of questions, we know which one you're referring to that you don't need to have us answer again. Okay, first question. Can people sign up for the portal without being an existing patient? If they can, how do you stop Dappy Duck and other silliness signups from flooding the portal? The current portal, you need to get the patient a token to sign up.
Yeah, so that's a great question. So patients that are not already part of your practice, they don't have any demographics in your system, would not be able to receive the invitation. So it's solely through email. So until that record is in the system and they have those minimum demographics entered, the enrollment wouldn't be able to be sent. So yeah, it would be restricted to just your patient population. That's a good question.
Okay, perfect. Next question. We currently utilize custom health history templates that are sent to patients via the portal. Once completed and are sent back, our staff are able to import the discrete data directly into the chart. We've looked at the health form options and feel it isn't as robust or as user-friendly as what we currently use. Any ideas when custom templates that allow for discrete data to be imported will be available?
So there is some availability, which sounds like you might have already researched this, but with those health forms, to have it come in as discrete data. So for example, like if you take that general registration and health history form, but again, I understand there are some limitations of how that can be customized. But as far as beyond that, there is the ability to use IMH forms or instant medical history. But again, that is another add-on product, just to be transparent. That does give you a little more customization, and that information does come in as discrete data. But beyond that, I know they are constantly, adding new features and kind of, making this more robust of a portal. So unfortunately, I don't have a timeline for you if that's on the roadmap, but that would be a great idea to submit, something that they could potentially look at. But yeah, at this time, really, as far as to have discrete data, that your options would be either modifying that general registration health history form or utilizing IMH forms.
Great, thank you. Next question. What were the recommended platforms? This was towards the beginning of the presentation.
I think I might have to have that person, if you're still on the line, if you could clarify. I don't want to go off on a tangent, and it's not even what you're asking. So if you could just kind of clarify what your question was in regards to. I don't want to.
Then we'll circle back to that one.
Tell you wrong.
Okay, perfect. So we'll get back to that one. Do you have to use NextGen EDI to see reminder info? We are using a third-party vendor for the reminders. We can see that reminder info in the portal. Can we see that reminder info into the portal?
Okay, yeah, that's a great question. So there are a couple different options that you do have for appointment reminders. One of those being EDI, but it's by no means required. There is some additional functionality that goes along with EDI. Namely, one of the big differences between the portal reminders and EDI would be the ability to have voice reminders, and also for those reminders to go out to patients that are not enrolled for the portal. I know there's some options with that with EDI. But there is with the base portal, if you're using just appointment requests, there are reminders that can go out. Those can be by email or text. You can set up different cadence for that. So 3 days before, even an hour before, however you'd like to set that up. And that just come with the base portal. And then in addition, with the patient self-scheduling, there are reminders that go along with that as well. As far as using a third party, I don't want to give you a definitive answer of no, but that would be my guess. As typically it's just going to be, again, those built-in options or NextGen EDI. But if you have questions about a specific third-party solution, that would be a great question to ask either your account manager, or if you work with us directly, you can ask us, because there are ways to make that communicate. But as far as like a full integration, it depends on the specific product you're using. So hopefully that gives you somewhat of an answer.
Okay, and it looks like we got some clarification on the previous question. One of them was Chrome, and what was the other?
Okay, I was thinking for a second, I was like, maybe that's what they meant. So yeah, the different platforms, the recommended ones are Google Chrome and Firefox. So yeah, those are definitely the ones that kind of, technically the portal on the website, works on all browsers. But just from my experience and what I've heard reported, the kind of best chances are with, again, Google Chrome and Firefox. So if they're using any other browser, they could have a potential for issues, not necessarily, but
Okay,
that's
perfect.
kind of the recommendation.
Can we still print a portal enrollment token letters after the upgrade?
So you cannot. So that is one of the features. There will be no tokens anymore for enrollment. It will solely be email invitations, and it basically gives the patient a link they can click on to register. I will say that something that NextGen has mentioned is kind of on the roadmap is the ability to include text message invitations as well. So if the patient doesn't have an email address, doesn't want to give you it, that's an option. But as it stands currently, and no tokens, no ability to print, solely email. I will say along with that, there is the ability to have one email address shared. So for example, if it's like, the mother wants to give her email address for both of her children who are patients, that's an option as well. So if the patient doesn't have, an individual email address, just something to keep in mind.
Okay, thanks. Next question. Will it send the message if a patient appointment is changed, edited, or just when it's initially scheduled?
So I'm assuming you mean like the appointment reminders. So the confirmation that initially goes out, that is done when the appointment is scheduled. And then those reminders will go out, whatever the cadence you have set up. So if there, are differences in that, they'll be able to see that in those, additional reminders that go out, if that makes sense.
Okay, perfect. If a patient enrollment has already been triggered, can another be re-triggered from the EHR?
Yes, so there are a couple options with that. The first is if it failed for whatever reason, there's some issues. So basically when a user would see that in a couple places, but one of those would be like that icon in the patient information bar. So they can go ahead and click that enroll now again. It will let them know, it was sent. So either if there was an issue, it failed, or just the patient never responded, and it will give the patient or the user, the option to resend that enrollment. So that's one of the options. Another option is you can set up in your configuration the ability to have invitations automatically resend. So, you can say after, maybe 72 hours, if the patient doesn't respond, it will send them another reminder to go ahead and sign up. So those are kind of the two options. So either manually or you can have that automatically happen, depending on your configuration.
Great. Next question. So if a patient doesn't have an email, is there no way to enroll them in the PXP? Can they be exempt from the PI MIPS measure? And I think that Holland can chime in on this one too.
Yeah, I can take this one. So as Lexi mentioned, unfortunately, unless there is an email, there is no way currently to enroll them in the PXP. Hopefully down the pipeline, there is a functionality that's going to be coming with a phone number potentially. And unfortunately, they also cannot be exempt from the measure. So with it coming in with that phone number, hopefully that kind of gets the ball rolling. But
Okay, perfect. Thank you, Holland. Next question. Portal enrollment is still part of the MIPS interoperability measures, correct? With all the patients being unenrolled in the legacy portal and having to re-enroll in the new PXP, what are your recommendations for practices to avoid missing their MIPS measures? Holland, do you want to take that one too?
Yep, I can take this one too. So you are correct in the fact that portal enrollment is still a part of MIPS interoperability. Your patients are going to be mass re-enrolled in the new portal, so there should not be an issue. The one thing I am going to recommend is not choosing a 90-day reporting period in which the time that you're going to be taking that transition. So I would look at maybe 90 days before the switch to the PXP or 90 days after the switch. And with that being said, maybe track both and see which numbers are higher so you can kind of get the most out of that measure.
Oh, good call. Nice idea. Okay, next question. If you send a message to a user, will the other person in the practice see that person's inbox?
Okay, so I'm assuming you're saying if it's like sent to a user work group and then it's responded to. So the functionality of that kind of remains similar with the legacy portal. So if it is sent to a work group, when the user goes in to respond, they'll accept that message, and then that will take it out of the other user's inbox. So they will, not be potentially working on the same message or responding back, multiple times to the same patient. I will say, however, if that does happen, so I'm as a user, I take that message, I plan on responding. and then, you know, the day gets away from me or something happens, I do have the ability to kind of send that back and include a note kind of as to why, you know, maybe what steps you've taken, but you didn't actually respond to the patient. So you do have the ability to do that.
Okay, and this next one isn't actually a question, but I'll let you chime in on it anyways, Lexi. It would be great if active recall plans could be added to the appointment request workflow so clinic staff can see what the patient is due for as compared to the appointment they are requesting.
I think, yeah, so you mean if they're sending in a request, I like that. I think that's a great idea for an enhancement. You know. I will say, as far as the recall plans, this isn't exactly in response to your statement, but they will have the functionality to be able to be sent to the portal. So, you know, patients will receive that and then, you know, hopefully be responding as a result of that. But I understand that is a great idea. That would be nice.
Okay, next one. What kind of patient verification or authentication steps are required to ensure that the portal enrollment link is being by the patient and protected against HIPAA breach if the enrollment token was sent to the incorrect email address?
Yeah, that's a great question. So there are a few pieces of information the patient has to enter in order to get, you know, to the actual point of creating the account. So just off the top of my head, it's the patient's name, email address, phone number, zip code. I believe I'm correct in that list. And so basically, yeah, they'll get that initially. Oh, birth date as well. I don't know if I said that. So that demographic information will be entered. It'll be checked with what's, you know, in NextGen, and then if it matches, they can continue on. Yeah, so no, that's a great point. Yep, exactly. If it goes to the wrong email, or, you know, even if, you know, it's a guardian and maybe they have multiple patients they're enrolling, it can make sure that, you know, they're, you know, enrolling for the right, you know, the right child or the right patient. Yeah, it's a great question.
Great question. Okay, next one. Do you have a sample, a recommendation, or a recommended decision tree that you can share with us that you can share with practice during configuration? Wow, I am just having trouble with this question. Thank you. Specialty specific.
Yeah, what are you guys saying?
Wow.
Yeah, that's definitely something we can make, yeah, some recommendations for, yeah, with the decision trees. Same thing with the health forms. We definitely have some samples that we'd be happy to share to kind of help you give some ideas of you know, how you can set that up. Yeah.
And I think that we did share an example of a decision tree before you'd asked the question before we'd gotten to it on the PowerPoint. So you know, feel free to reach out to us if you have specialty specific questions that you're curious about. You know, give us some more information. We'd be happy to help with that. Okay, next question. The features sound great and the user interface looks more user-friendly for the staff, but support with the patient have when there's an issue logging out or setting up their account or linking multiple practices, etc. Is there a hotline or support chat so the patient doesn't take up client resources to troubleshoot?
That is another great question. I'll say this original PowerPoint was about twice as long, and for time's sake, I did trim it down. You guys are asking all the questions of the things I had to cut. So no, it's a great question. So yes, there is, I think personally, I think there's a lot of support, and it makes it even easier than it was with NextMD, which I think is awesome. So first, on the initial page that the patient goes to log into for the portal, there is a forgot a username or forgot password link. So that would allow the user to get that information, you know, with hopefully not even having to reach out to the practice, which I think is awesome, or even reset that password if they can't remember what they configured it to be. So that's one option. Another option is there is a chat feature that is available. So off the top of my head, I believe I'm correct in saying it's available from 8 a.m. to 8 p.m. I believe it's Eastern. And so that chat feature is available. They can chat with a live representative, you know, get help. And that is something that they are also looking into expanding into a phone number as well to call if, you know, patients just kind of need additional support and don't want to use that chat feature. So that is a way, yes, definitely to get support, again, without, you know, putting the burden on the practice. And then kind of the third option besides, you know, the patient troubleshooting themselves, you know, using that chat feature, there is ability in the practice portal to be able to do things like see the patient's username, reset passwords, resend invitation links, manually enroll or unenroll a patient, things like that. So there is a lot of ability on the practice side as well. But again, I totally understand, obviously, hopefully they can figure it out either, through the portal website, the chat, but then, last step in the line, they can come to you and you can use that practice portal. That's a great question.
Can adult patients who share an email address link their accounts like they currently can? We have many patients who use this option and haven't seen any reference to it in the PXP training. We've only seen references to parents accessing minor children.
Yeah, so there is ability to have linked accounts in the portal. So you have the ability to, like you said, for parents to, as a guardian, to have access, but also you can link accounts. The patient can choose to do that with really any any other person. So if maybe between a spouse, if they want to link accounts, things like that. There definitely is that functionality.
What a great feature. Okay, next question. Can you limit the medications they can choose to just the active meds?
Yes, so that is one of the things that you can configure is whether it's just active, inactive, to see both. Yes, that's definitely an option.
Will custom forms be inserted into doc management and/or EHR categories?
Yes, so when those custom forms are returned, you'll be able to find them in the categories tab of the EHR, as well as on the encounter. That's correct.
We've been working with our portal install, and they've told me that pre-build forms are not working consistently. They've had trouble with the data not pulling through.
So that is not something I've personally has experienced. It doesn't mean it's not happening out there, just with the client base I've been working with. But I would say, definitely keep working with that team. And I'm sorry that that's happening to you. Hopefully they'll get that fixed. I know they're constantly working on improving and putting out. One of the things that's kind of different with the way they're handling this portal, as I feel like it's done in the past, is they are sending out new features, improvements, as well as break fixes. They're doing it instead of, in just a giant upgrade, because, everything's kind of cloud-based. They are pushing them out. I mean, in my opinion, it seems to be about monthly. Maybe it's not that often. But I will say that is the good thing is, it's constantly being, improved and known issues are being resolved. Again, you don't necessarily have to wait for a big upgrade or a patch or something like that. And they're just automatically pushed out. So there's not really anything that a practice has to do. So if you're ever curious about that or for your specific issue with the forms on the Success Community on the PXP page, you can usually find the release notes and see what was either introduced or fixed with that release, which again, and maybe monthly is not accurate. Every few months, it's pretty frequent.
Can we please get a list of the add-ons?
Yeah, I can definitely. I'll send when we send out the slides, Chelsea, if that's possible.
Yeah, we can include that. Yep,
I'll definitely include the documentation on that.
Perfect. Thanks for the request. Sign-in-less appointment scheduling link question. So if the patient doesn't sign in, how do we know that Joe is scheduling and not Tom?
So based on the patient, so they would have to still enter like demographics. Depending on your configuration, they most likely will have to enter an account number unless you disable that. So that does give you some verification of who the patient is and where it should go. And then if they do include all the information and an account number and there is a match in your system, then that will automatically create that transaction that can go in the batch. Otherwise, there is a template that can be used to basically allow you to go in. It's kind of similar to, in like the Rosetta holding tank, if you need to match, a lab order comes in and can't find a match. It's similar to that with transactions. So if there are any issues matching, you can go through and you can match that manually if needed. But again, hopefully the patient enters the information, it's matched automatically using the login list. That's a great question.
When a patient selects a practice for appointment, can the system only show providers for that specific practice? We have over 10 practices.
So yes, there are different settings. So you can limit the options that a patient sees to select from. And yes, that is an option to do that, as well as you can limit that they can only see or select their last seen provider is another option. Because I know, yes, some practices, they don't want, patients jumping from provider to provider. Yes, there are definitely some configuration options for that.
Can we still see in EHR when the patient last requested their PHR through the portal?
So there are, some ability to see that information. Specifically in the EHR, you'd be able to see that on that PHI log. It will show you a list of basically when it was either, automatically sent or, if it was manually sent, manually requested, you would see that in that PHI log.
Can you clarify which features are add-on to the base portal, NextGen Pay, health forms?
Yep, so the add-ons essentially are the patient self-scheduling, the PreCheck, the NextGen Pay. I guess technically IMH would be considered an add-on if you did, that's a separate purchase. Those would be, I believe I'm listing all of them. Those are all the add-ons. So yeah, basically included is the messaging, the appointment request, again, not self-scheduling, just the request, health forms, patient education. I know I'm missing some prescription refill requests. I believe I got all those.
Perfect.
Mm-hmm.
Okay, next question. When the PHR goes to the patient initially and they request PHR later, does it duplicate data for them or just update or add to what they already have?
Yeah, so it's a great question. So basically every time that either it's requested, manually sent automatically, it will create a new document, and that's what goes up at the top of the screen. And then at the bottom of the screen, they'll see a list of all those past requests. So essentially it'll take, that data, and then we'll add anything that's new, and that's what they'll see at the top. But they will always have the ability to go back if they wanted to and see, what was previously sent.
Okay, perfect. NextGen Pay, are these real-time balances?
Yes. Yep, they are real-time balances. That's a
Easy
great question.
answer. Are all documents generated in the EHR automatically sent to the patient portal if they're already enrolled after the encounter is locked?
So no, documents would need to be sent to the portal specifically. So you can use kind of all of those same options you have with the legacy portal. You can right-click on the document in the patient history toolbar. The custom print and send. If it went through the PAQ, you can send it to the portal that way. Yeah, so you would still need to go through and actually send those over. Really, the information that's automatically sent over is more like the clinical and demographic data.
I missed it. Is the bill pay option add-on feature, or does it come at no additional cost to the practice?
Bill pay is an add-on feature. Yep, so that's a separate purchase.
Are the statements only viewable by the guarantor, or will the other parent be able to see them too?
So the statements would be able to be viewed by the guarantor account, but then any accounts that are linked to it as well. I will say, just to clarify that, out of the box. So typically, but you do have some ability to limit what is visible based on those linked accounts. So if you did want to control, specific pieces of information, that is an option as well. But typically, it's out of the box. It's visible by everyone that's linked.
Okay, perfect. Does the PXP work equally well with Windows and Mac computers?
From my experience, I haven't seen personally or heard of any issues between Mac and PC. I mean, that's kind of the beauty of it being web-based. So I would say yes. I do know, like I mentioned, Google Chrome and Firefox being the preferred web browsers. So as far as things like viewing it on Safari, again, theoretically there shouldn't be an issue, but there's possibility to have an issue just based on the web browser. But beyond that, it really is just a website that theoretically patients should have no issue with. And I know I've accessed it on my own iPhone and not had any problems. So I would say yes.
Perfect. What version of the MedFusion portal system practice template will be retired? Yeah.
Yep. So yeah, I think I understand the question. So yeah, that portal system practice template, that is the last version that's available in is basically like PXP 1.0 is what they're calling it. Essentially, that's anyone that's not on the portal that comes with the 6.2021.1 upgrade. So that new portal, which they're calling, the one that goes with that upgrade, they're calling 2.0. So that is when it will no longer be available. So essentially, if you have the portal prior to that spring release, then it would still be available, but not after that date.
Okay, next question. Will the bulk enrollment invite work for patients whose enrollment is pending in the legacy portal, or will it only work if the patient is fully enrolled?
So that's a great question. It's my understanding that it will just go based on, any kind of the email address and any kind of, attempted enrollment. But that is a good question. I'm not 100% positive on that answer. That would be something when you go through your implementation, that's something that the implementation team can clarify for you. But again, it's my understanding it's just as long as they were in some stage of enrollment, it would carry over, but they can definitely clarify that for you when you get to that step.
Slightly similar question here. Do the initial enrollment email links expire after so many days?
They do. So that is another configuration option. So you can choose how long the patient has before that link expires. But yes, they do expire after whatever period of time you set.
What is MedFusion?
Oh, that's a great question. I know I'm using that term like everyone knows. So if you're not aware, MedFusion was actually the company who originally created what we're now calling the PXP Portal. And they were purchased by NextGen, I want to say a year, maybe 2 years ago. I don't know, the years are blending nowadays, but kind of, a little bit ago. They were purchased by NextGen, and now it's fully, that was the process to kind of fully rebrand them as the Patient Experience Portal. So yeah, that was just the old name of the company. So you will see as part of that transition, sometimes you'll see the name MedFusion, like Site Generator, for example, still has the MedFusion logo on it, things like that. But it is fully a NextGen product now. It's just, again, they're in the process of kind of phasing all that. Correct, exactly.
When is PreCheck available to use?
So PreCheck, it's a feature that's available now. So again, that is one of those add-on products. So basically, as soon as you would go ahead and implement your PXP portal, typically they might recommend a little bit of a lag time just to help the practice, make sure they get used to it. But then PreCheck can be installed right after you implement the portal.
Will the bulk invitations sent out to current legacy portal accounts, will it include any legacy portal accounts where a patient has no email?
So it will not. So that is, again, one of the things I definitely recommend, even regardless if you don't think you're going to take this for another year, just starting now and going through and making sure that you have an email address, first of all, and it's also up to date. If you collected it 5 years ago, you maybe just double check. So maybe include it as part of your, check-in process, maybe to just verify, if they're, or appointment scheduling, if they verify address, just ask for that email address. Yeah, definitely recommend starting that process as soon as possible because it does need that email address. And kind of along the same lines, just a recommendation as far as that process goes, is the invitation that the patient will receive. It will just be the standard portal invitation that even with that bulk invite, it doesn't give really any explanation of, okay, I thought I was already enrolled, nothing changed, why am I asking to enroll again? So I highly recommend as a practice, another thing that you can start doing, again, even if you think you're a ways off, start communicating with your patients, start letting them know that a new portal is coming, they're going to be asked to enroll again. It's not spam, it's coming from us. So you can do that, in a lot of ways, signs in the office, if you're using NextMD, maybe sending out a bulk message, maybe reminding patients when they're calling to schedule, just whatever process is to make that more seamless and, not catch patients by surprise. That's just something I always recommend.
Great ideas, yeah, because if I were just to receive an email out of the blue, I might be concerned as well.
A little suspicious, yep.
Yep. As far as things that have to match, if you have a 5 plus 4-digit zip code entered and the patient only enters the 5-digit, will the enrollment recognize them when they go to set up the new enrollment?
Yes, in my experience, I haven't had any issues with that. Yeah, I'm sure most patients won't know the full with the extension. So yeah, no, I haven't seen any issues with just putting in the first 5.
Isn't the chat feature more money?
So I will say that's a great question for your either your account manager, or again, if you are direct with us, we can get you that information. Because as far as pricing, there are a lot of factors that go into that. So again, unfortunately, I can't give like one blanket answer. Yeah, so that would be to determine if that is something that would be included or be additional. That would be a good question again for either your account manager or if you come directly with us.
And ask. Okay, so one username password, but 2 adult patients can each see their own records in the portal?
So that's a great question. So it can be one email address, but they would still create 2 unique username and passwords. It's just linked to the one email address, and then some of the information is linked, which is an option. Obviously, if it's parent guardian that, or excuse me, guardian and child, that child might not necessarily create their own username and password, which is fine. But yeah, it's the shared email address, but unique username and passwords. That's a good question.
Thanks for the clarification. In the EHR, are you able to change what categories the forms come in under, or do they only come in under the MedFusion category?
No, you are able to customize that. Yep, so you can create that, either send it to an existing category or rename, create a different category as needed. Yep.
Can you specify on what clinical and demographic documents that are automatically sent?
So I'm assuming the question is for like that personal health record. So it just, off the top of my head without seeing it in front of me, I mean, like demographics, it's going to be like patient's name, it, has like address, things like that. And then there's also, some vital signs. So see, the last like recorded, height, weight, blood pressure, things like that, as well as, clinical information, like visit, details that might have been entered, like allergies, medications, problem list. If you use care teams, they'll have their care team list. I'm sure I'm missing a lot. Medications, if I didn't already say that, histories, things like that. So it's
allergies.
Pretty, yep, allergies, exactly. I believe I listed all of those. Hopefully I didn't miss anything.
Can patients limit what info is shared with the extra people they add onto their account? For example, could they have their mom see it all, but say they just want their dad to only see the billing and statement info, but not the PHR?
So there are definitely some options for controlling, what information is seen by, anyone with a linked account. That's a great, if maybe the payment information, only needs to be seen by the parent, but not the child, or, things like that. Yes, there are definitely options to configure that.
Okay, and last but not least, we've made it to the end of the question. When will the recording be released? Great question. I will answer that one. This is clearly a really important one for a lot of people, so I'm going to do my best to get this done as soon as possible. I promise to have it sent out by Friday at the latest. Hopefully before then. I'm going to move this to the top of my list, but I've got to get it all uploaded and get everything programmed onto the website. So it'll be a little bit, but by the end of the week, for sure, you'll have this in your inbox. And at that point, if you have any questions that occur to you, feel free to always reply back to that email, and we'd be happy to answer them. I'll get them directed to the right people. Otherwise, you see both Lindsay's and Helen's information up on the screen. I'm sorry, Lexi's and Helen's information up on the screen. You can feel free to reach out to them directly as well. Basically, any way that you can get a hold of us, we're happy to help. That's why we're here. Please go on to LinkedIn. Tell us what you want to hear next, because as I keep saying, we do these for you. So let us know what you want to learn about. We're passionate about doing these. We like feeling like we're doing them and giving you guys the information that you need to succeed. So, any way you can get a hold of us. If you don't have LinkedIn and have an idea for a webinar, feel free to email any of us. That's why we're here. We're happy to help. So please don't hesitate to reach out to us. And thank you all for joining us today. I know this was a really long one. Sorry to run over an extra half hour with questions. I don't know if we've ever had so many questions. So thanks for hanging in with us and being interested.
Yeah, thank you, everyone. Really appreciate great questions.
Great questions. Well, enjoy the rest of your week, and we'll be in touch soon with the link to the recordings and slides.
Thank you.
Have a great day.